All right, in this video we're going to be going over a double leg hip internal rotation. The goal here is to stretch and create a little bit better workspace inside the posterior lateral capsules of the hip. So what we're going to do here is we're going to start with feet right underneath the knees. From here we're just going to kind of test. Can we get knees together? If we can, we walk the feet out a little wider and then we push them in, and we're going to progressively do this until we find a spot where we can't quite get the knees together. And as long as there is no inside knee pain or pinching in the hip, this is where we're going to work from. So you'll take both hands, as long as it's pain-free and clear, you'll push your knees together until you either feel restriction or you feel a stretch. Stretch is going to most likely be on the outer portions of the hips. So we'll hold this for anywhere between as little as 10 seconds upwards to 2 minutes, depending on what we've recommended for you. So the hands block the outer thighs, and then the knees are going to try to open up against the hands as the hands resist. This is part one of the engagement. Part two, we're going to try to drag the feet together towards each other as we continue blocking the knees. And if you get that correct, it should feel like a deeper engagement in the back side of your hip joint, potentially in your butt. All that's fair game. So you're going to hold this for 10 to 30 seconds once you have a nice, good, clean engagement, and then you'll just relax. After the relaxation, we should see some improvement of the knees going in closer together, and then we will rinse and repeat. Now, if you're doing this and you have inside knee pain, usually what you have to do is foam roll the outer portion of your hamstring. If you're pushing in and you have lateral knee pain, or maybe the entire knee hurts, you might need to foam roll the lateral hamstring and the inner thigh. Worst case scenario, when you go to do this motion, if you get knee restriction, you're going to need to foam roll something here or out here. So work this in as best you can. Ideally, this is going to be best done daily, and I hope this helps improve your hip mobility.